All physicians are taught in medical school the triad of diagnosing diabetes, which is excessive hunger, thirst, and urination. Many of us are developing diabetes without having those symptoms prior. It's late in the manifestation of diabetes that people actually develop those symptoms. It's so important that we recognize the other patterns that we can see in looking at people as far as their structure is concerned. Diabetes, or people who are predisposed to diabetic tendencies, oftentimes will have abdominal girth increasing. They'll have little ridges in their necks and other creases of their body. They'll have tiny papules that appear in rows along their neck and other thin-skinned areas. If you have a family history of diabetes, that's one of the risk factors. If you're developing hypertension, that's common with diabetes. Certain lipid parameters related to cholesterol and triglycerides are recognizable as far as predisposition to developing diabetes. Diabetes is all about losing the circulation to the various parts of the body. There's a predilection for diabetes to take out the smallest vessels in the eyes and the kidneys, in the feet. For that matter, diabetes is the leading cause of blindness, kidney failure, and amputations. So it's really important that you recognize that someone is developing diabetes, control their risk factors, including their lipid parameters through proper medication, diet, and exercise. Do everything we can to see to it that if it's preventable, that we do what we can to see to it that they avoid the diabetic consequences. That's what we're all about here at Dallas Family Medicine.